Maxillary canine is the third tooth from the midline. Its tooth number in FDI system is 1, 3 and 2, 3. In universal system 6 and 11. In Zsigmondy-Palmer system the tooth number is 3 with appropriate quadrant brackets. The word canine has been derived from the Latin word canis, which means dog, signifying the prominence of this tooth in the animal. It has been called by many other names like cuspid, corner tooth, eye tooth. Its main function is tearing. Canines help in guiding the jaw to close in correct position. If a person closes the mouth in a slightly lateral position, the mandibular canine will contact the lingual side of the maxillary canine and the jaw will automatically get aligned in correct occlusion. This is known as the canine guidance. Canines are generally the last teeth to fall in the oral cavity. This is because of two reasons. Firstly, it has the longest root, which makes them more stable. Secondly, the crown is convex from all aspects with very little concavities. This makes it self-cleansing as food lodgement is very difficult and so caries occur rarely. Canines are very important in patients' aesthetics. Due to their location, they support the corners of the mouth. Their absence causes drooping of the lips and may give an aged appearance to the patient. The thickness of the root results in a protuberance on the alveolar ridge of the maxilla called as canine eminence. A slight concavity just posterior to it is called canine fossa. Maxillary canines are the second most common impacted teeth in the oral cavity after third molars. This is because both lateral incisor and first premolar erupt before canine and therefore may leave insufficient space. Canines develop from four developmental lobes. They are mesial, labial, distal and lingual. The mesial, labial and distal lobe forms the labial aspect of the crown, in which the labial lobe is more developed and so forms the cusp. The less developed lingual lobe forms the cingulum. The age of eruption of maxillary canine is 11 to 12 years. Coming to the measurements, the cervico-incisal length of the crown is 10 mm and root length is 17 mm. The mesodistal diameter of the crown measured at the contact area is 7.5 mm and at cervix is 5.5 mm. The labiolingual diameter of the crown at the level of cingulum is 8 mm and at cervix is 7 mm. The curvature of cervical line on the mesial aspect is 2.5 mm and at distal aspect is 1.5 mm. The tooth morphology is studied under 5 aspects. Let's start with the first aspect, the labial aspect. From the labial aspect, the crown's outline form is trapezoidal in shape with the longer parallel side towards the cusp and the shorter side towards the cervix. The cusp tip is seen at the midline axis of the tooth. Two cuspal slopes are seen. Mesial cuspal slope runs from the cusp to the mesial contact area and distal cuspal slope runs from the cusp to the distal contact area. The distal cuspal slope is longer than the mesial cuspal slope. The two contact areas are at different levels. Mesial contact area, by which the canine contacts the lateral incisor, is at the junction of the incisal third and middle third. The distal contact area, by which the canine contacts the first premolar, is at middle third. The distal outline running from the contact area to the cervix is slightly more concave than the mesial outline. The cervical line is convex and the convexity is towards the root. The labial surface is smooth and prominently convex. The labial ridge runs from the cusp tip to the cervical line and has a bend mesially in the middle third. Slight concavity may be seen mesially and distally to the labial ridge, demarcating the developmental lobes. The root appears smooth, convex and tapering towards the apex. Coming to the palatal aspect, as the palatal side is narrower than the labial side, all the features of the outline form from the labial aspect are same in the palatal aspect as well, though the surface of the palatal aspect is very different. 5 ridges are seen from the palatal aspect. 2 cuspal ridges. Mesial cuspal ridge runs from the cusp tip to the mesial contact area and the distal cuspal ridge runs from the cusp tip to the distal contact area. 2 marginal ridges. Mesial marginal ridge runs from the mesial contact area to the cingulum and distal marginal ridge runs from the distal contact area to the cingulum, and 1 lingual ridge that runs from the cusp to the cingulum. The large convexity called the cingulum is located in the cervical third. Between these ridges and cingulum are 2 very shallow concavities called the mesial lingual fossa and the distal lingual fossa. Next is the mesial aspect. From the mesial aspect, the outline form of the tooth is triangular or wedge shaped. The cusp tip is not on midline axis of the tooth but is slightly labial to it. The labial outline is prominently convex due to the labial ridge. The maximum convexity or the height of contour is at the level of the cingulum. The lingual outline is complex. It is convex in the incisal third, then concave in the middle third, and then convex in the cervical third. The cervical line is convex and the convexity is towards the crown. The root is smooth, convex and tapering towards the apex. A mesial developmental depression is seen in the middle third along the long axis of the root. Now the distal aspect. The distal aspect is exactly the same as the mesial aspect. Only the distal developmental depression on the root is slightly deeper than the mesial developmental depression. Lastly, the incisal aspect. As with all permanent teeth, no part of the root is visible from the incisal aspect. The labiolingual dimension is more than the mesodistal dimension. This functional adaptation is because the forces applied on this tooth are more in the labial direction. Labial outline is prominently convex due to the presence of labial ridge. Lingual aspect is narrower than the labial aspect due to the lingual convergence, which is a feature of all anterior teeth. The cusp tip is slightly labial and mesial to the center.